This is Eagle News. I'm David Oria in Washington. It's Saturday, March 25th, 2023, here in the U.S. Capitol. The week's recap begins with the United Nations warnings that the future looks bleak if not enough climate action is taken to combat what many fear is inevitable. Rosel Feria reports.
The Intergovernmental Panel on Climate Change releases its latest findings. It says human activities, principally through emissions of greenhouse gases, have unequivocally caused global warming. The panel says the increase in global surface temperature has caused climate extremes in every region across the globe. It warns increasing global warming will lead to species extinction and irreversible loss of forests, coral reefs, and Arctic regions. UN Secretary General Antonio Guterres describes the current condition of the world.
Dear friends, humanity is on thin ice, and that ice is melting fast. As today's report of the Intergovernmental Panel on Climate Change, IPCC, details, humans are responsible for virtually all global heating over the last 200 years. The rate of temperature rise in the last half-century is the highest in 2,000 years. Concentrations of carbon dioxide are at their highest in at least 2 million years. The climate time bomb is ticking.
Although the outlook is grim, he emphasizes all is not lost.
But today's IPCC report is a how-to guide to defuse the climate time bomb. It is a survival guide for humanity. As it shows, the 1.5 degree limit is achievable, but it will take a quantum leap in climate action. This report is a clarion call to massively fast-track climate efforts by every country and every sector and on every time frame. In short, our world needs climate action on all fronts, everything, everywhere, all at once.
Rosel Feria, Washington, D.C., Eagle News. We live in extraordinary times.
An alarming and growing threat of a drug-resistant fungus is spreading in healthcare facilities here in the country. Arlene Ocampo tells us more.
An urgent antimicrobial resistance threat, Candida auris, or C. auris, is increasing at an alarming rate in healthcare facilities here in the country. The Centers for Disease Control and Prevention, or CDC, warns that in 2021, the number of cases resistant to antifungal medicine most recommended for treatment of C. auris infections has tripled. CDC says the rapid rise and geographic spread of cases is concerning. C. auris case counts have increased for reasons including poor general infection prevention and control practices in healthcare facilities. Public health investigations suggest that the spread of C. auris may have worsened due to strain on healthcare and public health systems during the COVID-19 pandemic. CDC says C. auris is not a threat to healthy people. People who are very sick, have invasive medical devices, or have long or frequent stays in healthcare facilities are at increased risk for acquiring C. auris. The health agency underscores the need for continued surveillance, expanded lab capacity, quicker diagnostic tests, and adherence to proven infection prevention and control. Arlene Ocampo, Washington, D.C., Eagle News. We live in extraordinary times.
In Canada, the city of Toronto releases the most recent data on people experiencing homelessness there. The report reveals that individuals without homes are at risk of dying earlier than the median age of death. Yolanda Espiris reports.
Toronto has seen an average of 3 deaths per week in 2020 among people experiencing homelessness, according to recent data released by Toronto Public Health this month. It is reported that 187 people experiencing homelessness died last year. They are also at risk of dying prematurely. To compare, for the general population in Toronto, the median age of death is 79 years old for men and 84 years old for women. For people who experience homelessness, that median age of death is alarmingly almost cut in half. 55 years old for men and 42 years old for women. Drug toxicity is the leading cause of death for people experiencing homelessness in the city, followed by cardiovascular disease, cancer, unintentional injuries, and suicide. Almost 30% of the reported deaths have unknown causes. Toronto Public Health vows to continue working with the city in implementing the Toronto Drug Strategy, creating affordable housing, and addressing opioid-related deaths in Toronto's shelter system. Yolanda Aspiras, Toronto, Ontario, Eagle News. We live in extraordinary times.
This week, we asked our neighbors how the pressing global issue of food insecurity is affecting their households, their very tables. We also asked suggestions on how we can, in our own little way, fight the hunger in our homes. Malia Simbulan reports.
U.S. Department of Agriculture says that the current food prices are 10% higher than their prices in 2022. Eggs, however, which are staple food in America and around the world, had the largest price increase of 70% compared to its average price last year. How concerning are these price increases, and how does this affect our everyday life?
Food's a very important part of everyone's life, and yeah, it can be disorienting to see the prices of something that's needed for life going up faster than you can keep up with it.
I eat a lot of red meat, so the price of steak and lamb have went up a lot, so it's kind of affecting my budget. I probably spend about $800 to $1,000 a month on food, and that's a lot.
The cost of living has increased, especially in LA and other major cities in the U.S., so I think it's a really important issue.
Inflation is at 40-year highs. I know eggs are just getting ridiculous, anywhere over $10 for a carton. That's insane. This is just food we're talking about here. So yeah, it's been a little difficult. It's always darkest before the dawn. I'm sure we're gonna see the dawn here soon, but right now prices are skyrocketing. And so I think we're all doing our best to just survive and get through, and then we can get back to the thriving part.
When the world isn't catching up in the job market to be able to compensate people appropriately to give them access to food, we're depriving humans of something that they have the right to access.
Clearly, the ballooning food prices is not only stretching our grocery budget thin, but is also the root of a deeper socioeconomic problem that is food insecurity. In our own household, what can we do to fight limited access to food?
Be wasteful is the worst thing I could do right now.
I probably go to the grocery store like 3 to 4 times a week, and I always eat what's in my fridge.
Being mindful of your own food usage and maybe excess consumption.
Volunteering at your local food bank is really important. Donating any extra resources you have, whether it's time, money, or food. Also working with folks to get everyone employed so that they can afford food themselves.
Those who have excess also have the resources to give back. And so those who might feel food security have a due diligence to give back to their communities, whether it's financially, whether it's with time, whether it's with volunteer work.
Millions of households around the world are food insecure. And we learned from our survey several things that we could do to alleviate this issue. Now let's ask, what do they think is the cause of food insecurity?
Maybe the climate has something to do with it. I don't want to go down that rabbit hole, but yeah, that might have something to do with it. Maybe the growing population of the world could certainly play a part.
Well, I don't know this for sure, but from what I understand is that the war in Ukraine is definitely not helping the situation because we get a lot of our fertilizer from Ukraine. So that, of course, I know drought was suffering. So I know Texas had like a heat wave, so a lot of cattle died. I think pigs were dying in China, and I think recently chickens had the flu here in the U.S. So I think things like that have affected, and I know, I guess, feed prices for the animals, that went up as well. So I think that's affecting food prices. So yeah, it's out of our control, but it is kind of crazy.
I would say access is huge. There's generally enough food in the world for everyone. It's just kind of getting it where it needs to be. And then also folks' ability to kind of grow their own food and provide for themselves is really challenging. I think providing resources to women and mothers who maybe aren't able to work outside the home is really important so that they can get access to food for themselves and their families.
I think one of the many reasons for food insecurity is lack of accessibility. And when there are areas in the world that are able to have so much in excess and not be able to share the wealth and share the resources, you're depleting people around the world of something that we have enough of. We definitely have enough food around the world to feed everybody. It's just who's holding on to it and who's willing to share.
These factors may or may not have been the causes of inflation and food insecurity. But one thing we'll learn is for sure, most of us are impacted by skyrocketing food prices. And with willingness to adapt and by practicing mindful consumption, we will thrive whatever economic climate we are in. Myla Simbulan, Swarthmore, Pennsylvania, Eagle News. We'll live in extraordinary times.
Several stories from Thomas Likeness today. From a soon-to-be ex-Prime Minister disliking social media, to plastic rocks found on the shores of Trindade Island, to a robot programmed to care for the elderly. These stories and more on this week's Correspondent at Large.
And now news and commentary from around the globe. The outgoing Prime Minister of Scotland is no fan of Facebook, Twitter, or other forms of social media. In fact, Nicola Sturgeon says these platforms are harmful to democracy.
But right now it feels that the damage social media is doing globally to public discourse and to democracies is outweighing the benefits of it.
Sturgeon says social media has created an unhealthy environment in politics. She says the political climate has become harsher, especially for women and minority communities.
It gives racism, misogyny, sexism, bigotry generally, none of these new phenomena by any means, a platform and a vehicle.
Can't say I disagree with her. From my own observations, there's not a lot of depth in the political discussions that I see on social media. From the political environment to the marine environment now. Just how widespread is plastic pollution? Well, the tentacles of human activity have reached to a remote island in the Atlantic, thousands of kilometers away from any other land. The end result? Plastic rocks. Trindade Island is about 1,100 kilometers off the Brazilian coast. This island is virtually uninhabited, except for a small base the Brazilian Navy maintains there. But on the shores of this island, geologists have found rocks formed by plastic pollution. So, where does this plastic come from? Mostly from fishing nets, but also other plastic rubbish that's dumped into the ocean. The plastic debris washes ashore, then it mixes with the island's volcanic rocks. And as it gets warmer, the plastic melts, and it, of course, embeds itself in the rocks. Similar rock formations have been found in Hawaii, Britain, Italy, and Japan. Scientists fear that as these rocks erode, they may leach microplastics into the ocean, and that could contaminate the food chain. And how is Germany handling a shortage of healthcare workers for elder care? Well, it's recruiting robots. Meet Garmy. Garmy is a robot that can perform diagnostics on patients. It can also provide care and treatment for patients, and at least that's the plan. Now, this robot is a product of a new sector called geriatronics. Geriatronics marries geriatrics with advanced technologies like robotics, information technology, and 3D technology. For now, Garmy works out of a lab attached to the Technical Institute of Munich, getting ready for the future, because in the next 25 years, Germany anticipates it will have a shortage of 670,000 care workers. The government is hoping robots like Garmy can fill the void and perform some of the tasks done by, doctors, nurses, and other caregivers. These automatons could even someday be of service to patients who live at home, kind of a live-in caregiver. The robot builders say the biggest challenge is going to be getting patients to accept the robots. How would you feel about receiving care from a robot? A birth announcement now, this one from a zoo in Belgium. This rare Rothschild's giraffe was born last Wednesday. At birth, it weighed 70 kilograms and stood 1.5 meters tall. That's right, it stood. The animal was on its feet just minutes after birth. It's being looked after by its mother now. Gender not yet known, and so far the calf has not yet been named. Zoo officials say the calf has eaten well and is getting to know other giraffes in the group. I'll be back in 7 days, and in the meantime, I wish you all peace, joy, and happiness in the ensuing week. Thomas I. Likeness, Correspondent at Large, Eagle News. We live in extraordinary times.
In other news, in a campaign to boost teacher workforce in the state, Governor Shapiro of Pennsylvania is calling on aspiring educators to help with the shortage. Mila Simbulan joins us again on Learning Curve.
Pennsylvania Governor Josh Shapiro shares his vision for rebuilding Pennsylvania's teacher workforce. He encourages new teachers to join the profession and ease the burden on existing teachers. Last week, the governor unveiled a set of common sense solutions to the most pressing issues facing Pennsylvania communities. Among the most challenging, a major shortage in educators across the Commonwealth. In Philadelphia alone, there were over 200 unfilled teaching jobs at the start of the 2022-2023 school year. The governor's budget proposes a refundable tax credit of up to $2,500 every year for up to 3 years for anyone who earns a new license or certification in education, nursing, or law enforcement, or for anyone who already has a license in those fields and decides to move to Pennsylvania for work. To ensure every Pennsylvania student has access to a quality education, Governor Shapiro's budget includes an increase of more than $560 million. That is 7.8% for basic education funding, in addition to targeted support to help students learn and grow. Mila Simbulan, Swarthmore, Pennsylvania, Eagle News. We live in extraordinary times.
Meanwhile, new CDC data reveals that tuberculosis cases increased again in the year 2022. Here's Bernadette Regini on Health is Wealth.
March 24 is World Tuberculosis or TB Day. Ahead of this, the Centers for Disease Control and Prevention, or CDC, releases new data showing that the number of TB disease cases in the country has increased by 5% in 2022. That's an increase of 8,300 cases. The number, however, did not return to pre-pandemic levels. The CDC says public health officials were concerned about delayed or missed diagnosis of TB disease in 2020. This after a substantial 20% decline that year. Today, 2 years later, CDC data signal a rebound in cases. Considerable increases among some groups include children aged 4 and under, people who are incarcerated, people from some racial and ethnic groups. TB is one of the world's leading infectious disease killers. The health agency calls on healthcare providers and communities disproportionately affected by TB to think, test, and treat TB. Bernadette Regini, Virginia Beach, Virginia, Eagle News. We live in extraordinary times.
The running of the 38th Los Angeles Marathon witnessed Kenyan Stacy Ndiwa and Ethiopian Jamal Yamer seize victory in the women's and men's categories. Race conditions were cool and at times windy and wet due to the occasional rain and showers. This makes for a welcome, if not watery, victory for the winners. In Los Angeles, California, Alan and Ava on EBC Sports International.
African runners once again dominate the Los Angeles Marathon, with Kenyan women taking the top 3 spots and Ethiopia claiming first and second for the men.
But while athletes stormed the course, off and on rain was in the forecast, making for a much cooler and overcast race.
It definitely helps having an overcast, the cooler temperatures, especially mile 18 as there's a little drizzle, cools the body temperature, which is going to bring the heart rate down a little bit. So before that, I was actually dumping water on me to keep my body a little cooler, because once it spikes, it's going to stay up and that heart rate is going to get a little out of control. So tried to stay on top of it with keeping my body cool anyway. But Mother Nature came in and gave us just what we need, some rain. So it was awesome. An amazing goal would have been an OTQ today, but I know this is a very hard course to do it on. But you got a dream, right?
Overall, the weather was very good for the event. It didn't add up with the time that I wanted or the praise. I wanted to win this race, but finishing on the podium is still okay. There was so many people cheering out there. They don't know you, but they are cheering you, go 106. Oh, and then that helps a lot when we are running out there.
Oh, today is I'm happy. Oh, it's a wind. Yeah, wind. Up, down, hard course. Yeah, hard course. Oh, I love you, Los Angeles. Yeah, I'm happy.
It is so windy, so I struggle because of that windy. Up to 20 kilometers, and then I try to increase the speed, so that's why I won this race. Maybe I'll go and work hard. Then when I'll come next year, I'll be the winner again to maintain the title.
There are easier ways to see the LA sights than huffing it on foot for 26 miles.
But running a marathon might be the better choice for those looking to hit the road while leaving the car behind.
Yvonne Allen, Los Angeles, California, Eagle News. We live in extraordinary times.
In Papua New Guinea, governors gather in an inaugural consultative conference in the capital city. One resolution is the transfer of administrative and financial authority to the provincial government. Echo Ordeleza Quinola on Oceania at a Glance.
"17 out of 20 governors in Papua New Guinea attended the first ever Governors Consultative meeting. The event is co-hosted by Port Moresby's Honorable Governor Poes Parkop and Hela Province Governor Philip Undialu. One of the resolutions is the transfer of administrative and financial powers to the provincial government. The provincial leaders also tackle issues about the decentralization of political powers to the provinces. The two-day governors' meet concludes with the presence of Prime Minister Honorable James Marape. He commends all governors for gathering together in a bipartisan approach. He asks help in tailoring a system that is complementary to national government as far as delivering services and ensuring the citizens of Papua New Guinea's welfare.
All leaders on the table, it's a bipartisan approach. The Governors Forum has members in the opposition side as well as government side. But when it comes to common good for our people, we come together and make resolutions that is befitting of our people. All in leading up to our life as a nation beyond 50 years of independence by this September 16. We hope to have total clarity on what our roles, responsibilities, functions, and functions of provincial government, national government, districts, and agencies. In that clarity, we hope to be expeditious and efficient in the way we do business and service to the people.
Echo Ordeleza Quinola, Port Moresby, Papua New Guinea, Eagle News. We live in extraordinary times.
It is cherry blossom season once again. And here in Washington, D.C., thousands of fans flock to the Tidal Basin to bask in the pink shade of these beautiful flowers reaching its peak bloom. Elise Danielle reports.
Every spring here in Washington, D.C., cherry blossom trees are a sight to behold. These trees are a reminder of the friendship between the people of the United States and of Japan. According to the National Park Service, this week marks the peak bloom of these beautiful trees. The average peak bloom date is around April 4. It is when 70% of the flowers of the cherry blossom trees are open. The blooming period can last up to 14 days. They say the best time to see them is from 4 to 7 days after peak bloom begins. The blossoms, however, can last for up to 2 weeks under favorable conditions. A few warmer days coming up will bring many more of these pretty flowers out. Surrounded with beauty here in the U.S. Capitol, Elise Danielle, Eagle News, we live in extraordinary times.
And before we let you go, here's our photo of the week. Here's a very charming photo of 2 cherry blossom fans admiring the water while being surrounded by the famed attraction. Look at them, not minding the hundreds of other spectators strolling about. Thanks again, Elise Danielle, for capturing this moment. Thank you all for joining us again. If there are stories or topics you want us to share with you, just comment below. View, like, share our other shows. City Limits with Alan Basaliaje. Connected with Dr. David. Take a seat and join us with Anna Cui. Plate Date with Mike Hudson and Friends. Plus, Journey, Stories of Filipinos Abroad with Kathleen Cruz. Follow us on YouTube, Facebook, and Twitter at Eagle News Live. I'm David Oria. We live in extraordinary times. Stay safe, everyone.